Hello, and welcome to Coding Week 1. So I hope everyone can hear me all right. This is Week 1. My name is Doreen Bovin, and I will be your instructor for roughly the next 20 weeks. Tonight will be a little bit of an introduction and how to get started with your billing and coding course. So the first thing that I'm going to go over with you is your course guide. It was sent to you in your welcome email, and it starts off with getting around Evolve. The second page is all about Jabber and setting up a Jabber account. The third page is tips for a successful connection. If you do use Jabber, you want to make sure that you are hardwired, not wireless. The fourth page is your assignment checkoff sheet. I suggest that you write your grades on this assignment checkoff sheet every time you take an exam on Evolve. You can even write it in pencil so that we can change the grade if for some reason you score low and you want to retake the test. If you retake the test, I'll turn around and let you know what your changed grade is. But you do have to take all of the exams. And then you'll see the course syllabus, which is roughly a 20-week course syllabus. We start right in with week 1 with our Health Insurance Today book. This is your Health Insurance Today book. It is by Beek, Janet Beek, or Beek, B-E-I-K, Health Insurance Today. This is where we will be learning the billing and reimbursement side of the course. So for the first 5 weeks, we will be going through this book. So you do not need your workbook or textbook for these weeks. Pretty much follow the syllabus unless I indicate otherwise in the lecture. So you will notice that week 1 you will do unit 1, which is chapters 1 through 4 in your text in your book, and you have questions throughout the book. What did you learn? What did you learn? And then you will have exams on Evolve as well as activities that you will be doing. And that's going to be the billing part of the course. Then down on week 6, we get into the step-by-step book. And this is your textbook. Okay? It will probably say 2015, if not 2014 is fine. And the workbook. With those books, you will also have your ICD-9 book. It might look like this. Or like this. You should also have what is called a CPT book. That will look like this. and you'll have what is called a hick pick book. It might look like this, or it might be big like the CPT book and spiral bound or hardbound, but it will be a hick pick book. Usually what I have everyone do is read the chapter ahead of time, do any of the exercises related to those chapters, come to class, we will review the chapter, and then take the exam on Evolve. Now, if for some reason you score low and you would like to retake it, I ask that you email me and just ask to reset the exam, or can I look at it to give you a better score. What I want to let you know is that Evolve is very particular. So if you put in a space or you add a hyphen or you misspell a word, you may have put the correct answer, but Evolve does not recognize it. So that means that gets marked incorrect. So before you get frustrated and upset with Evolve, please just send me an email that says, Doreen, I am on week 2, chapter 4. Could you please take a look at my exam? I think I have these correct. And then I will respond to you over the weekend and let you know what your score is. Now, I'm available by email. If you want to set up video conferences or phone call conferences, we can do that just by sending me an email that says, Doreen, can we set up some phone time or a video chat? The course is roughly about 20 weeks. Some chapters we might get through a little quicker than others. And that's okay. It all just depends on everyone's learning style. You all did receive a welcome email from me, and in there I gave you some tips on successfully getting through this course. Some of those items have to do with, as I mentioned earlier, reading the work, doing the exercises, coming to class for the review, and then going back and taking the exam afterwards. Also, the lectures are not optional. When you are ready for a lecture, you are to email me every week when you're ready for the lecture, and just in the subject line, please put lecture week 6, chapter 22, 23. And I ask you to do it that way because there are students who are doing the last session and the weeks may be off by a few weeks, just depending on how the pace of the course went. So if you could please, in the subject line, please put the lecture, the week, and the chapter. Also, excuse me, have a little bit of that upper respiratory stuff going on. I apologize. Also, the answers, we will go over the answers at the end of every lecture. If we don't get a chance to, you can email me and request the answers, and I'll be happy to send them to you. When I assign homework in the Buck book, I will go over that more in depth when we get into the Buck book. Don't hesitate to email me with questions. Just know that if you want me to review an exam or respond to lengthy questions, it might not be until the end of the week. Usually if you ask for a lecture, I usually leave by 7 o'clock in the morning, and I'm usually home by 6, 7 o'clock at night. So if you email me between 7 and 7, you probably won't get that lecture right away. But if you email me in those other times, I usually get that lecture right back to you. Again, the videos are not going to be on Evolve. So what I'd like to do now is share my screen with you so that we can just go over Evolve for a moment. All right, you can see here. Here's Evolve. And you've all pretty much taken and used it for terminology. So you will log in. Now I have a lot of stuff on my screen because of being an instructor. So for coding, when you open up to your Evolve, you will basically see your terminology. You should see this course right here, Evolve Resources for Health Insurance Today. Then you should see the medical coding, and it should be the 2014 edition. And then when it comes time to do the exam review, your course will say Coding Exam Review. I will give you access to each course as we start that course. So by Friday, I'll have everyone set up with access to the Evolve Resources for Health Insurance Today. When you click on the Health Insurance Today book, you're going to see the layout like this. And I've made all the student resources available. And underneath, you will see all of the chapters. And if you click on the chapter, it will give you chapter review questions. And you begin the assessment. This is your exam. So you actually get 2 attempts on this. So you have to submit the first one before you can take the second one. And it will give you the best score out of the 2. If for some reason it does not come back with a score, please send me an email and I'll take a look at it. Also, websites to explore. It gives you some nice links that help us learn with our learning in the billing part of the course. You'll see here that they have information on health insurance in the United States. It gives you the cms.gov website on healthcare, COBRA insurances. So some very helpful information to just take a look at. Again, just go to each chapter. You'll have your chapter review questions. Those are your exams. If you want to see what other student resources there are, just click on Student Resources. I apologize for the connection. Just one moment. All right, you'll see that there's a blank CMS 1500 form. This will be used later on when we fill out a claim form. You will not be doing any of the Metasoft activities. That is not something that we have access to for this course. So really, all you're going to be concerned with underneath your health insurance today will be each chapter and your chapter review questions. Then to go back to the beginning, just go back to My Evolve. And as I said, your page will come right up to what you have in your Evolve online. When we get to medical coding, you will see that over here on the left, you have your content home, you have your exams. This is where you're going to find all the exams for the course. And under resources, this is where you will find some extra coding activities and some online activities. I also want to remind you to be using Google Chrome or Mozilla. And that's it really. You're going to have access to your terminology, the Health Insurance Today book, and the Buck Medical Coding Edition. Now, one last thing I want to show you on the coding exam review. When you click on this, all that will be under here is the exam portion. So click on Resources. And then you will have the exam review. It's not coming up. All right, when it gets here, you might have to click Open to bring you to another window. All right, when this screen comes up, this is the introduction. You should print this page. Click Continue. Now here, you want to enter your first name, your last name, your email address, and verify your email address. And that's how you want to go in every time when you do start to take this exam. Because it's going to remember you by how you logged in. And then click Login. And this is what you will see. You will click on the pre-exam and take the pre-exam. As we get closer to doing this, I will talk more about it, but I just wanted you to have the reference of seeing it and understanding what you will be doing. And you also have quick quizzes underneath here that you can also take as well. You can do these even before you start to take the pre and post, or you can take them afterwards. Once you are done the pre-exam, you will save and print your results because I will want to see your results. And then you can actually exit and go back into this later. But again, remember how you logged in so that you go in each time and it saves your grades under that manner. All right, so that is Evolve. Again, you want to make sure if you have a misspelling or you add a hyphen or you put too many decimals, whatever it is, just beware that Evolve is very picky. Okay? So, for tonight, we're going to start with Chapter 1 in the Health Insurance Today book. So even if you haven't started the course and read any of this, that is fine because we're going to review it. And what you might want to do is stop the video here and go read the chapters and then come back and review it, listen to it, or you might want to have the book open as I'm reviewing it, and then you can go ahead and read it and answer the questions in the book. All right. Just one moment. We will actually go over the what did you learn in the book. So you might want to have a separate notebook where you answer the what did you learns. On page 3, there's what did you learn. On page 4, there's 3 questions, what did you learn? We will review those. That will give you some more practice. Okay, so next week we will actually review the answers to the what did you learn. So for Chapter 1, the origins of health insurance. Well, what is insurance? We have insurance because it helps protect us against loss or harm. It is also the act or business of protecting an individual's person or property against loss or harm that arises out of a specified circumstance. And in return for a payment, it's called a premium. An insurance policy on page 2 in your textbook is a written agreement between 2 parties. One entity, the insurance company, promises to pay a specific sum of money to the second entity, who is the policyholder, if certain undesirable events happen. And what are the reasons that we have health insurance? Well, to protect us from exorbitant medical bills and access to quality health care. Medical insurance and health insurance, or health insurance, basically narrows down the undesirable events to illnesses and/or injuries. And what it does is it helps to pay a portion of the financial expenses that are incurred. It also helps to cover expenses as a result of covered medical procedures, services, and certain supplies performed or provided by other healthcare professionals. So for instance, take a look at the insurance puzzle up at the top of the page on page 3. When we think about the term medical insurance, it shouldn't cause us to be apprehensive. And it's actually a good analogy to put medical insurance into perspective. We might want to compare it to a picture puzzle, like the one on page 3. So when we take the puzzle pieces and we dump them onto a table, there's little meaning or continuity to the jumble of pieces that we see laying on the tabletop in front of us. Then as we slowly assemble those pieces, a picture begins to take shape and the puzzle starts to make sense. Similarly, the medical insurance can be perplexing as individual concepts are presented, but once you look at it under the whole picture, it becomes clearer and more understandable. So as we begin to appreciate how you see this puzzle piece fitting together, we then begin to understand the whole picture more easily once we see it completed. As you see above in the book on page 3, the medical insurance puzzle is complete. So we have EOBs that go to or come from third-party payers. We have health insurance professionals who are the RMAs and the CMAs and the providers. We use CPT coding and ICD coding, the providers use it, and it helps us to create claims which we in turn send over to those third-party payers. So let's do a little bit of history of the health insurance world at the bottom of page 3. Well, we begin in modern health insurance. It occurred in England in 1850 when there was actually a company offering coverage for medical expenses for bodily injuries that did not result in death. Justin Kimball of Baylor University in Dallas introduced a plan to guarantee school teachers 21 days of hospital care for $6 per year. That's pretty good. This plan eventually evolved into what is known today as Blue Cross. The Blue Shield concept resulted when owners of mining camps in the Northwest paid monthly fees to medical service bureaus in return for providing medical care to their workers. And this is where we have the metamorphosis of medical insurance. In 1965, you'll see that Medicare and Medicaid were enacted. And in 1973, an HMO Act was passed over on page 5 in your textbook. An HMO is a plan that provides health care to its medical facilities or to its enrollees from certain healthcare providers and medical facilities that contract with the plan. There are usually no deductibles to be met and no claim forms that need to be filed. The Blue Shield concept Sorry, we covered that. Your indemnity insurance. Bottom of the column on the right-hand side on page 5. The traditional type of healthcare plan that does the following. That's your indemnity insurance. It provides comprehensive major medical benefits, and it allows the insured to choose any doctor or hospital desired when seeking medical care. Excuse me. So in 2010, the Patient Protection and Affordable Care Act, as well as the Healthcare and Education Reconciliation Act, came into being. So some of the key health insurance issues on page 7 would be to keep costs down, regulate the health insurance industry, introduce more effective medications and treatments, stabilize utilization of emergency departments, prevent chronic diseases, protect patient privacy, and expand the use of EMRs. From one of the two sources, we can access health insurance, and that is either government or private organizations. So to access, having access to health insurance in the law, all Americans, with some exceptions, are required to have health insurance beginning in 2014, or they're going to face a penalty. The individual states must have health insurance exchanges, which you see on page 7 on the right-hand column. This is a set of government-regulated standardized plans that are eligible for federal subsidies from which individuals can purchase that low-cost insurance. It is illegal, keep this in mind, it is illegal for any health insurance plan to use pre-existing conditions to exclude, limit, or set unrealistic rates on coverage for adults. What is HIPAA? HIPAA, over on page 8 on the left-hand column. HIPAA requires most employer-sponsored group health insurance plans to accept transfers from other group plans without imposing a pre-existing condition clause. Your state programs for the uninsured, you'll see that the Affordable Care Act expands coverage to people who do not currently qualify for state Medicaid programs. The federal government provides states with 100% financing for those individuals newly eligible for Medicaid for the first 3 years. And then we have the Children's Health Insurance Program, which is CHIP, that provides insurance for qualifying children who are eligible for Medicaid, but they cannot afford private insurance. So what are some of the ways that we can help control healthcare costs? We want to stop insurance company abuses. We want to crack down on Medicare waste and fraud, eliminate subsidies to private insurance companies, introduce payment reforms that allow providers to deliver care more effectively, offer tax credits for small businesses to help cover premiums for their employees, make affordable insurance exchanges available in the health insurance market, and provide tax relief that cuts costs of insurance while guaranteeing access to the basic health benefits. That's on page 9 in your textbook. So what are some of the factors that affect healthcare costs? Well, we have Americans living longer. We have advances in medical technology. a rise in chronic diseases, more demand for health care, and media intervention. As you can see at the bottom of page 9, figure 1-4, it gives us the national health expenditures over the course of the last 20 years. Okay, and then we have battling the rising cost of health care. We have cost sharing. This is where the insured individuals pay a portion of the health care costs, which is usually deductibles, coinsurance, copayment amounts. So page 10, cost sharing. And then how much is enough? Well, the idea behind insurance is that a group as a whole shoulders the burden of paying the expensive medical care. So your basic health insurance plans are the fee-for-service, which is your indemnity, or managed health care. And we do have some additional types of health care plans that have been proposed, such as health insurance exchanges, which are more recent, and your ACOs, which are your accountable care organizations. All right, and that is it for chapter 1. Any questions? All right, one moment. You'll see that these chapters are pretty quick to get through. So let's move on to chapter 2. All right, so chapter 2, let's talk about tools of the trade. So some tools of the trade. You want to have entry-level skills necessary. Maybe have some college courses. Definitely have some good study skills and demonstrate the importance of time management. So what it comes down to, part of it is your future as a health insurance professional. If you choose a job you love, you'll never have to work a day the rest of your life. And sadly, my friends think I'm crazy because I love what I do, and I do. I can honestly, truly say that I love what I do. There's a standing joke between my friends and I that um, I am teaching Billy and Cody because we were having a conversation at a dinner gathering and someone didn't hear me clearly and asked me who Billy and Cody was. And I said I was talking about the class that I was teaching, medical billing and coding. And so we always have a good laugh about it. But I can honestly say I do love teaching this course and doing my work, which is billing and coding. And I do a little bit of it all the time, and in the practices that I work in and the training that I provide. So I hope that you find enjoyment in doing this as well. So some of the required skills and interests obviously come down to reading and comprehension, some basic business math, English and grammar, oral and written communication, keyboarding and office skills, and computer application skills. So don't be shy in any of those areas. Get right down into it and learn it. Learn everything you can about all the resources available to you. Some of the education part that you might want to get, which is part of why you're here, is the anatomy and physiology, the medical terminology, maybe even some keyboarding, because you might not be particularly efficient at keyboarding. Learning word processing, business English, business math, and some administrative skills. There are specialized courses on page 15 in your textbook, the medical transcription, medical records, CPT, ICD-10, medical insurance billing, which we're doing now, computerized office management, and then bookkeeping and accounting. What's some preparation for this? Well, prioritize your life. If you didn't have it prioritized before now is a good time to start, because time management is going to become one of your best friends. So prioritize your life. Learn how to study, okay? Develop a weekly time management schedule in which all of your activities are prioritized by importance. Allow time for studying, spread out your time throughout the week, permit time for recreation, rest and family, and grant periodic rewards, such as watching TV or lunch out with friends. Make a list of all the things you need to do, just as you make a list for your grocery shopping, all right? And then learn how to study. Choose a quiet place where you can concentrate and have minimal interruptions. Develop a positive personality trait. So positive attitude, being diligent, integrity, objectivity, initiative, and prepare for class. So how do you get prepared for class? You want to attend every class as much as possible and become an active participator. Outline, underline, highlight, make notes in the margins, and then I definitely will be, as we move forward, show you how to make notes in your ICD-9 and CPT and HCPC book. Over on page 16, there's a time management schedule there. Now that's just an example, but definitely map out one for yourself. Learn how to prioritize your life. Create a workable schedule and adjust your schedule as needed. When developing your positive personality traits, it doesn't mean that you need them all, but just develop some that feel right and good for you. On the job skills, page 17, pay attention to detail, follow directions, work independently, possess strong professional ethics, possess strong people skills, be conscientious, and possess manual dexterity. Some specializations, job specializations and duties. You might look at when you're trying to find jobs for this particular type of work, it might be a claims assistant professional. It might be medical coder and coding specialist, or medical claims processor, or reimbursement specialist, or billing coordinator. It could also be a patient account representative, a medical claims reviewer, medical claims analyst, electronic claims processor, or medical collector. So when you're looking for jobs, look for these titles because that is where you might find them. They might not be listed just as one thing. So what are some of the responsibilities that you would have? Scheduling appointments, bookkeeping and other administrative duties, explaining insurance benefits to patients, handling the day-to-day medical billing procedures, adhering to each insurance carrier's guidelines, documenting all activities using correct medical terminology, keeping current with regard to coding and compliance, completing the claim forms, knowing and complying with laws and regulations. All of these responsibilities, you'll see them on the top of page 18 on the left-hand column. So what are your career prospects? Physicians or dentist office, pharmacies, home health agencies, mental health facilities, your physical therapy and rehab centers, your insurance companies, consulting firms. And what are the occupational trends and future outlook? Your employment prospects exist in medical facilities ranging in size from small staff of 1 or 2 healthcare providers to several hundred providers in a multi-specialty group. So you, the health insurance professional, also have the option of working independently from a home-based office. So what to expect as a health insurance professional? Step 1 is to research the duties and responsibilities. 2, enroll in a formal training program. 3, become certified. 4, obtain employment. And 5, learn and perform your job duties. 6, post payments. 7, report denied charges to a coding specialist. Generate and maintain a log, and then benefit from job security and flexibility. And what are some of the rewards? Lifelong learning or lifelong career. Monetary gain, job security. Personal challenges and personal satisfaction. Interesting and challenging careers. Opportunities for advancement, helping people in need. And knowledge that you are performing a vital service to the medical community. There are certification possibilities, as you see on page 21. It gives you a listing of all the places that you can go and get, and what type of certification possibilities there are. The certification is basically a culmination of a process of formal recognition of the competence possessed by you, and usually better salaries are earned. So I'm not going to read down through them, but they start with certified medical assistant and end with a certified coding specialist for physicians. The job prospects. The projected growth in the health service industry for medical billers and coders will be due to growing and aging population, the number of healthcare providers, federal regulations, and technological advances in medicine. You'll see on page 23 we have an electronic claim form, or we have a claim form. We will be sending electronic forms, but if for some reason you have to do a paper form, this is what they look like. And we will go through filling one out later on. All right. Any questions? All right. Okay, let's move on to Chapter 3. The legal and ethical side of medical insurance. So again, this week, just go ahead and read these chapters. Answer the what did you learn on the pages. There's usually, 1 to 3 questions. And then next week, we'll come back and answer those what did you learns. Okay. So Chapter 3 is all about, excuse me. Chapter 3 is all about the legal and ethical side of medical insurance. All right, medical law and liability on the bottom of page 27 over to 28. We have employer liability and employee liability. Respondeat superior. This is let the master answer. It's a key principle in business law. It is where the employer is responsible for actions of employees in the course of employment. Right down the bottom of page 28 on the left-hand side. Respondeat superior. So who can be held liable? Well, your health care providers, the doctors, your ancillary members of the medical team, they can be held liable. The insurance and contract law, some of the elements of a contract are offer and acceptance, number 1. Consideration, legal object, competent parties, and legal form, which is written contracts only. For competency, to determine competency, an emancipated minor is an individual under the age of 18 who's independent and living away from home, or individuals who are mentally handicapped. Termination of contracts, these usually occur by mutual agreement on page 29 in your textbook. Either party defaults on provisions, non-payment of premiums, fraudulent action, or at the discretion of the uninsured or the insured individual. The provider and patient relationship. They might have an implied contract. What's an implied contract? An implied contract meaning is that it's not in writing, but it has all of the components of a legal contract. So it's when you go into the room with the doctor for the first time, it's a brand new doctor, and you accept his care. That's an implied contract. That's a legal contract. Reasons to discharge a patient. They fail to keep an appointment, or they do not pay, or they refuse to follow physician's advice. When discharging a patient, you want to notify the patient in writing, provide a name of alternative caregivers, explain the medical problems that need continued treatment, and give a specific date of termination. Medical law and ethics that are applicable to health insurance. The relationship between a healthcare provider and a patient is an implied contract over on page 29 on the bottom right-hand column. This is just as binding as a written contract. What is the offer? The offer is that the patient enters into the office in anticipation of receiving medical care. What is the consideration? It is the provider's implied promise to render care to a patient, as well as patient's promise to pay that provider for care. What is the important legislation affecting health insurance today? Over on page 30. We have the Federal Privacy Act of 1974. This regulates the use of Social Security numbers. The Federal Omnibus Budget Reconciliation Act of 1980. This states that Medicare is the secondary payer in the case of an automobile or liability insurance policy. Tax Equity and Fiscal Responsibility Act of 1982. Medicare benefits, secondary to benefits payable under employer group, health plans for employees age 65 through 69. Your COBRA, or Consolidated Omnibus Budget Reconciliation Act. This is all legislation that affects our health insurance today. Over to HIPAA, HIPAA's privacy rule over on the right. The 4 standards or rules are privacy, security, identifiers, transactions, and code sets. Over on page 32, medical ethics and medical etiquette. Ethics. Ethics are standards of human conduct of a particular group or culture. The morals refer to actions. Ethics refer to the reason behind such actions. Medical ethics is the code for the healthcare profession. Hello?
Yeah.
This is the medical billing and coding class. All right, so we have medical ethics is the code of conduct for the healthcare profession. And then we have ethical questions in healthcare. And this is stuff that you can talk about, usually with family members and friends. Medical ethics, field of medical ethics, current area of concern. Some ethical questions regarding healthcare on page 32 of the bottom left-hand column. Abortion, experimentation, prolongation of life, quality of life, euthanasia. These are all ethical questions. They definitely spur debate. Medical etiquette, over on the right-hand column of page 32. Following the rules and conventions governing correct or polite behavior in society in general, or in a particular social or professional group or situation. Medical etiquette refers specifically to etiquette in healthcare setting. Patients are considered customers and they should be treated with respect and courtesy. The patient's medical record, over on page 33, is an account of the patient's medical assessment, investigation, and course of treatment. It's a source of information. What is the purpose of these medical records? It helps the healthcare provider render their care to the best of his or her ability. It provides statistical information for research, offers legal protection for the healthcare team, and provides support for third-party reimbursement. The complete medical record, you should have timeliness, okay? Timeliness means that the entries, such as the history and physical, must be made and updated within 24 hours of the encounter. Completeness, documentation of the patient's problems and concerns. Accuracy, confidentiality, demographic information. The list goes on right there on page 33 in your textbook. I'm not going to list every single one of those. Who owns the medical records? There is some controversy, but what it boils down to is that the property of the physician providing the care, he owns the medical record. He or she owns that medical record. The patient does not own that medical record. It is the property of the physician providing the care. Retention of the medical records, that varies from practice to practice. Every facility needs a written policy, and you must abide by state rules or statutes. The AMA physicians have obligation to meet ethical and legal obligations for good patient care. Who has access to medical records? Over on page 34. These are limited to certain situations such as treatment, quality assurance, utilization review, education, research. When you are releasing medical record information, a written consent is required. HIPAA allows billing of third-party insurers without patient's written authorization, a TPO, and there is a separate release required for any third-party payer. Documentation of a patient medical record. The medical record is a clinical, scientific, administrative, and legal document of facts that contains statements relating to that patient. We also want to make sure we're properly documenting health records that expands knowledge and improves the standard of medical care. There are two reasons records are kept: to document interaction between the healthcare provider and patient so that a permanent record of what was said and done exists, and to show ongoing process of patient care. Policy and performance, over on page 36. Every medical facility should have a policy to ensure that health record entries are performed accurately and in a timely fashion. Sometimes as ancillary staff, we can complete certain entries on the medical records. It lists in the book what those are. Documentation, having accurate documentation is critical to patient care. It must be timely, accurate, and complete. If we have poor documentation, that can result in record reviews and reduced or denied claim payments. If it isn't documented, it didn't happen. HIPAA's 4 primary objectives. HIPAA's 4 primary objectives on the bottom of page 36, right-hand column over to 37. The first one is to ensure health insurance portability, to ensure to reduce healthcare fraud and abuse, to enforce standards for health information, and to guarantee security and privacy of health information for patients. Who must comply? It shows you at the top of page 37. It gives you a figure 3-5. It shows you who must comply. So who does HIPAA impact? Patients, healthcare providers, private businesses. And here's the how-to HIPAA top 10 tips. You want to understand the deadlines and move to compliance. Know your requirements. Prioritize. Ask the right questions. Choose and use consultants wisely. Learn from trusted sources. Separate fact from fiction. Visit website resources often for the latest updates. Talk to your patients and look for AMA updates. So who enforces this? The Office of Civil Rights enforces HIPAA. There are both civil and criminal penalties for the wrongful disclosure of protected health information. So how do you develop a compliance plan? This is a significant tool for reducing the potential for healthcare fraud and abuse. It must be adapted and implemented appropriately to be effective. Confidentiality, it's the foundation for trust in the patient-provider relationship. All healthcare organizations and providers must guarantee confidentiality and privacy. Privacy refers to individuals' right to keep some information to themselves and to have it used only with their approval. Then we have privacy and HIPAA. Physicians must use and disclose only the minimum amount of information. Patients can request a copy of their medical records, and they must receive notification of their privacy rights. So you all go into your doctor's office or hospitals and they have it posted, or they have a brochure that they hand you. The security of medical records. Is on page 40 on the left-hand side column. The security of medical records is for maintaining them, reporting and responding, assessing, developing, training, and ensuring. There are some exceptions, like for the treatment of minors, HIV-positive patients and healthcare workers, the abuse of a child or adult, injuries caused by firearms and weapons, communicable diseases, billing TPO insurance. The authorization to release information. You want to make sure you have a HIPAA-related authorization. There are exceptions for signed release for insurance claim forms. They listed that in your book. Breach of confidentiality, bottom left-hand column on page 41. Breaches in confidentiality can be oral or written, made by telephone, faxed, or transmitted electronically. What is healthcare fraud and abuse over on page 42? Fraud. An intentional deception or misrepresentation of facts that may lead to unauthorized benefit. Abuse. Improper or harmful procedure or method of doing business. What is the cause and effect of fraud and abuse? Both providers and patients commit healthcare insurance fraud. Popular provider fraud schemes usually include billing for services and supplies that are not provided, upcoding, unbundling of charges or code fragmentation, and misrepresenting services. So how can you prevent fraud and abuse? You want to keep up to date with your payer guidelines, use current coding manuals, conduct periodic staff training, communicate with other staff members, and report suspected offenses. right. So at the end of the chapter, it gives you some summary checkpoints. Review those, as well as go to some of the websites to explore. All right, and we will move on to Chapter 4. Chapter 4 is about types and sources of health insurance. We have basic types of health insurance. We have indemnity, which is fee-for-service, and managed care. I mentioned those earlier. One moment. All right, the indemnity is the fee-for-service. It's the traditional kind of healthcare policy. Your patients can choose any provider or hospital. They can change doctors at any time. Then you have the policyholder, the insured, who pays a periodic fee, which is a premium. It's based on policy type and coverage. Better coverage equals higher premium, and a deductible equals a patient paying a certain amount of money upfront per year. How do we calculate the UCR? Well, first of all, what is the UCR? Over on page 48. The UCR is usual, customary, reasonable. It's based on historical data that's developed from some of the following criteria that you'll see here in your book. Charging for same and similar service, charging the variance by providers for same service, same geographic area, whether procedure requires more time, skill, or experience than usual, value of procedure compared to other services. What is an RBRVS, resource-based relative value scale? This is another widely used payment system. We see that it assigns value to every medical procedure, that calculates Medicare's fee schedule allowance. The cost is divided into 3 components: physician work, practice expense, and professional liability insurance. Your out-of-pocket maximum and lifetime limits on the right-hand column of page 48. You'll see that this is usually a specified amount of the patient must pay out of the pocket for covered services in a benefit period. The dollar limit includes deductibles, co-insurance, co-payments, and any other expenditure that the individual must pay that is considered a qualified medical expense. Your basic medical coverage will pay for the room and care while the patient is hospitalized. They might even cover certain hospital services and supplies. They pay toward the cost of surgery for some doctor visits, and it's typically used as a supplement. Your major medical coverage takes over where the basic coverage leaves off. It covers the cost of long and high-cost illnesses or injuries. It's a comprehensive major medical insurance or supplemental to major medical insurance. There are some exclusions in pre-existing conditions. Your exclusions would be illnesses or injuries that are not covered by the policies. Your pre-existing conditions would be physical or mental conditions that existed before the insurance issuance of the health insurance policy, or existed before the issuance for which the treatment is being received. Your preventative services, bottom left-hand column, page 49. Under the ACA, the Affordable Care Act, some people are eligible for preventative services at no additional cost. This provision only applies to those enrolled in plans created after March 23, 2010. Your standardized benefits and coverage rule over on the right-hand column of page 49. All your insurance vendors are required to provide consumers with a standard 4-page summary of benefits and coverage. If the insurance company wants to make major changes to a policy, the policyholders would have to be notified of the changes 60 days in advance. For managed care, the medical care provided by a corporation established under state and federal laws, organized way to manage cost, use and quality of healthcare system, and then several major forms. So you'll see that the advantages for this group contract would be that it's less expensive than the individual plans, and everyone's eligible, it's comprehensive, and it has HIPAA protection against pre-existing condition exclusion. Some of the disadvantages on page 50 on the right-hand column would be that there's little or no choice in the type of coverage, modifications to the policy are not optional, comprehensive coverage is lost when no longer in the group, and premiums for converting privileges to COBRA tend to be higher. To look at individual policies for someone who is self-employed, you as the individual can select the type of policy that best fits your situation. It can be individualized to the individual or family need. You, the individual, will control the insurance contract, and also usually does not lose coverage if you change your occupation. So that's the nice thing about having your own plan. Some of the disadvantages, though, are more restrictive requirements. Premiums are typically higher, lower limits for certain coverages, mental health, substance abuse. You'll see pre-existing conditions are often excluded. Some exclusions are more common, and then the insurer can terminate some policies under certain circumstances. Some sources of health insurance, you'll see Medicare is one of them, Medicaid, TRICARE and Chapt VA, and disability insurance. Medicare is a federal health insurance program. It provides benefits to individuals 65 years or older. The private supplemental policies offered to cover gaps in Medicare coverage. Medicaid covers some low-income individuals and certain disabled individuals, particularly your children and pregnant women. And then you'll have the joint federal-state health program, which is administered by individual states. You'll also hear of TRICARE and Chapt VA. TRICARE is the U.S. Military Comprehensive Health Care Program. All military hospitals and clinics are part of TRICARE, and your Chapt VA is the Department of Veterans Affairs Health Benefits Program. Disability insurance over on the right-hand column of page 51. Some types are private, Social Security disability, and workers' compensation. The Social Security disability insurance is the insurance program that's administered by SSA and funded by FICA. Your workers' compensation over on page 52 is pays workers who are injured or disabled on the job or have job-related illnesses. Over on the right-hand column of page 52, we have health savings accounts. These are also called medical savings accounts. There is a special tax shelter that's set up for the purpose of paying the medical bills, and it offers lower premiums, lower taxes, freedom of choice, and more cash at retirement. Your flexible spending accounts over on page 53. These are your tax advantage savings accounts. They are set up through an employer to allow tax-free savings for qualified medical or dependent expenses. And then we have the HRAs, which are your health reimbursement arrangements. And this is where it reimburses the employees for certain qualifying medical expenses. It is open to employees of companies of any size, and it will provide first dollar medical coverage until the funds are used up. Some of your premium reimbursement arrangement, or PRAs, these are for premium only. This is a relatively new option that you see. And employers allow their employees to reimburse themselves for their individual health insurance costs with pre-tax wages. Some other plans that are out there are the health insurance exchanges and the ACOs, which are your accountable care organizations. And those agree to manage all of the health care needs for a minimum of 5,000 Medicare beneficiaries for at least 3 years. Your long-term care insurance is your long-term medical, social, personal care services. It's not necessarily medical care, but rather custodial care. And two other optional plans are dental care and vision care. You also, under COBRA, what COBRA does on page 55 is it extends healthcare coverage after an individual leaves his or her place of employment. The individual must pay the entire premium. It starts on a date of qualifying event, and the benefits can last for maximum coverage period. That varies according to the type of triggering event. We have health insurance watchdogs. On the bottom of page 55, health insurance watchdogs, the Joint Commission, the National Committee for Quality Assurance, American Accreditation Healthcare Commission, Community Health Accreditation Program. The list goes on page 56, top left-hand column. Some other terms common to your third-party carriers is the birthday rule. This is used to determine the primary and secondary carrier when we are administering benefits for a patient who has dual coverage and a coordination of benefits clause. So the person whose birthday comes first in the year, not the person who is oldest. Some other terms you might want to know is COB, coordination of benefits, MOB, maintenance of benefits, medical necessity, usual, customary, and reasonable, participating provider, non-participating provider. Some of the miscellaneous terms over on the right-hand column of page 57, co-payment. Co-payment is a set dollar amount, like 5, 10, 15, 20. Your covered expenses are those that the insurer agrees to pay. Co-insurance is usually a percentage of the allowed charges. Excuse me. Over on page 58, you'll see a certificate of medical necessity, which usually needs to be filled out for Medicare patients when they need to have oxygen or hospital beds or other types of things. Again, review the summary checkpoints. It gives you a nice overview of the chapter. And then again, do the what do you think? Or what did you learn? Questions within the chapters. Any questions? All right, so for the first week, we usually have time to wrap your head around everything I threw at you tonight. If at any time you have questions, you can always play the lecture back, because the first part of the lecture is going over expectations of the course, and you all have my email address. If you are unable to make a class, please send me an email and let me know, and make sure you contact me to get the lecture for the next, that you missed. And I hope that I haven't overwhelmed you too much for tonight. So I want to thank you all for your time for tonight. Again, please reach out to me if you have any questions, and I look forward to seeing you next week. For next week, the assignment is to do the exams on Evolve for chapters 1 through 4 in the Health Insurance Today book. Read Unit 2, chapters 3 through 10, and respond to as many of the what did you learn questions as you can. We will go over chapter 1 through 4 questions next week. And that's it. That's it for tonight. Thank you, everyone, and have a great week.